what are the small things that can be done to prevent hypertension to start with? If you have to list it down, what will be your number one priority in terms of lifestyle change?
Exercise.
Exercise.
Yeah. I think it's quite well known in the medical science as well that regular physical exercise prevents high blood pressure. So in fact, I think even 20 years ago, the recommendation was that if you have blood pressure, you should be walking at least 20 minutes a day as a form of exercise, not as part of your
Regular
routine work. And just that walking itself will reduce your blood pressure problems. Because exercise has numerous health benefits, more than any doctor, any
Medication.
intervention or any medication can possibly provide you. But it's just that people need to understand that, accept it, and start doing it. That itself will improve health of people by leaps and bounds. So if you are hypertensive, definitely performing some form of physical activity for at least 20 to 30 minutes a day. The WHO recommends 150 minutes of moderate physical activity per week. So we say 5 times a week, 30 minutes per time. For 150 minutes is recommended. And over a period of time, that should bring your blood pressure into better control. Now, whether it will take you off medication or not depends on many factors.
You talk about the zone 2
Yes,
of your
zone
physical
2,
activity. So, in general, when we talk about exercise, at least in Indian community, walking is one of the most common thing.
Yes.
And there is a plus and minus to it.
Yes.
Plus is any physical activity is good.
Yes.
If you're in the couch or walking, of course,
Yes.
please get started. But considering just walking alone is a physical activity, you might not get the same benefits. Your hypertension might not be controlled.
Exactly.
And that's why you talk about the zone 2 where you exert your heart rate a little bit. Please educate on that.
So, if, as you know, the body is a very adaptable organism. And when you keep doing a certain activity over and over again, your physiology will adapt to it. So, if you were to climb 10 flights of stairs every day, after a month of doing that, the 10 flights won't seem that difficult. So, although you're doing the same exercise, the effect of the exercise has changed. So, that is something people need to understand, that although you are doing exercise every day, it does not have the same physiological effect on you if you continue to do the same exercise 3 months or 6 months down the line. So, there is a physiological adaptation that happens within us. So, for the same level of exertion, you will be actually expending less of a physical load than you were doing when you started. So the only way to understand how much of exertion you're actually putting into an activity is to measure your heart rate. Because that tells you what is physiologically happening to your body when you are engaging in that activity. So I can guarantee you that somebody who starts walking 30 minutes a day, in 6 months, the heart rate that he or she started walking at would have dropped. So that 30 minutes, 6 months down the line is not going to feel like 30 minutes. So either you have to walk at a faster pace or you have to walk longer. So measuring your heart rate is a very important step. If you cannot measure your heart rate, and I understand not everybody wants to get into the smartwatches or wearing a heart rate strap. Smartwatches, incidentally, are not very accurate because they are wrist heart rate measurements. So actually, a heart rate strap is what is more accurate. But if you don't want to get into that, the very simple rule of thumb is you should be walking at a pace where maintaining a conversation is a little difficult. So it's not like how you and I are talking now. So if I was on the phone talking to you and you were listening to me talking and I was performing a zone 2 activity, you would be able to tell that I was exercising. So it's slightly labored, but I'm able to talk. So if you can at least achieve this, that's more than enough. Because then you know that you are exercising at zone 2. So this is a scale that we use called RPE, rate of perceived exertion, which is actually very accurate, provided you understand that you're doing it the right way. So you don't need any fancy devices, you don't need measurements, just RPE is enough.
Most of the time people go for walking in the evening
But they'll be
work,
chit-chatting while they're walking.
on the phone, they'll be like, what is the recipe for medu vada? So I've said this repeatedly that if you are talking on the phone and walking, then walking is not.
Yeah.
I mean, it is better than nothing. But so that's a very interesting point. That same amount of walking will decrease in its efficiency
Yes.
in the next 3 to 6 months.
Yes.
That's fascinating. So you do cycling.
Yeah.
You do cycling. Cycling is considered as zone 2 to start with, or even on cycling, you have
Cycling can also be zone 1.
zone 1.
Yeah. You can have all zones in cycling. You can be doing very
Chilled, relaxed.
chilled ride, like what we call a cafe ride,
cafe ride.
where we all just ride to a coffee shop and we have coffee, chit chat, and come back. Sometimes you need that kind of ride also.
Usually people go to A to B. Cafe shop.
So we have that also, and then there are all zones in cycling which are possible. So I commute by cycle also.
To work.
Yes, because it's the fastest, most predictable way. If I have to get into the operation theatre at 8 o'clock sharp, if I take the car in Bangalore, there is no guarantee I'll be there. So
You'll be there tomorrow.
maybe tomorrow 8 o'clock.
So you bike.
I cycle to work most of the days. Yeah,
Nice.
and that's my zone 1.
It's a zone. That's a zone 1.
Yeah, so I cycle at a relaxed pace, and anyway, with the traffic interruptions, it's a slow ride.
Nice. In your patients, after the surgery, let's say you have a bleed and then you remove the clot and all those things. When you talk about exercise, what is the general reception among Indian community right now? Are they resistant? Are they hesitant? Or they want to do it but they cannot do it?
So a lot of my patients post-surgery, like spine surgery particularly, I advise them that the only way that you can keep your spine healthy, so whatever you did in your life up until now caused this problem. Now going forward, if you continue to do the same things, you will end up with the same problem. Albert Einstein's famous quotation is, insanity is doing the same things and expecting different results. One of my favorite quotations.
Of course.
So I tell them, if you do the same thing, you're going to end up with the same problem and you're going to come back to me and I may have to operate you again. So you have to do the exercises and you have to take care of your back. Exercise is a non-negotiable part of your treatment. There is no way you can escape it. It's part of your life now. So most of them get it, but a few of them, a year down the line, everything is healed, they're back to normal. They gradually stop doing the exercises. As you know, that's human mentality. And I believe that I try to emphasize consistency. I don't want you to be exercising like a gymnast. But I just want you to exercise 30 minutes every day, dedicated to your spine. That's all I ask for you. Not even every day, 5 days a week. Consistency trumps everything else, in my opinion.
Consider from the duration.
Yes.
That creates that neuroplasticity, form a habit.
Form a habit, make it part of your lifestyle, take care of yourself, be, what can I say, be a campaigner for your own health. Many people don't have they're not supporting their own health. They are not the voice for their own selves.
Of course.
Maybe for various reasons. They don't have time, they don't have the mindset, they don't feel they are worthy enough in some cases. So I think people need to start standing up for their own health and being a part of that process. That's how was a wake-up call for me in my personal journey as well. So that's why I said always, it's time to prioritize your health now. I think it's the bottom line for every doctor in social media. In the airline, they say when oxygen mask falls, put on your own mask first and then help someone. So you can only be an asset to your family or your society or to the world around you if you are in good health. And that's why I made my health a priority also. Because I realized that if I'm going to be giving advice to people that you have to take care of your health, be fit. If I don't look fit, how can I give that advice?